Tell me very quickly what you understand about why you're here to see me today, so I can make sure I know where to start.
Because I have a lesion on my lung,
Yeah.
and we're gonna get rid of it.
Okay, we do want to get rid of it.
Yes, and I don't want it anymore.
Yes.
That's right.
And as easy and fast and clean as possible.
Okay. So my understanding is that you met with Dr. Archer,
Yeah,
right, to talk about the surgical option.
yeah,
But based on everything that's happened recently, he didn't think it was the best idea.
I know, feel bad about that.
Yeah. Well, so there are always multiple choices, right, for treatment. I don't want to say always, but there are generally multiple options for treatment. And we have to consider all of them within the context of each individual patient, right? And so we usually do consider surgery as sort of the first option for patients who are in general well enough and who have good enough lung and heart function to tolerate the surgery. But some people can't have the surgery for one reason or another. And the good news is that we have good second options, right? So that's what we're here to talk about today.
Yeah,
So I'm a radiation oncologist, so my specialty is the use of radiation therapy, and a big part of my practice is lung cancer, so it's something I have a lot of experience with, all right? And the PET scan has suggested that the likelihood that this cancer has spread anywhere else in the body is very low, okay?
okay,
These tests are never perfect, right? So that's why I don't say always or never, but the likelihood that the cancer has spread to the lymph nodes or anywhere else is very low. And it seems that the cancer is sort of confined to the tumor in the left lung.
great,
And so that for that reason, we believe this to be a stage 1 cancer.
okay. Now, stage 1 cancer can go into stage 6 cancer, can it?
So right, so that's exactly kind of why I'm wording things the way that I am.
Okay,
Is
I'm
because
sorry,
no,
I
you're right.
jumped
No,
ahead.
it's fine. It's a very good intuition on your part. So remember, cancer spreads because any one little tiny microscopic cell has the ability to escape and spread through the blood to end up in the lymph nodes or in somewhere else. And we do these scans, right, CAT scans and PET scans and things, to be relatively confident that that hasn't happened, right? Because if, God forbid, we saw that the cancer had spread to the lymph nodes, it'd be a different stage and our treatment recommendations would be different. So we want to know as best we can, but there's no way we can know for 100% certainty,
Yeah.
right? So to your question, yes, we're going to treat this as though it's a stage 1 cancer, right? And stage 1 cancers come with good likelihood of cure, okay? And good overall chance of success, but nothing is 100%, right? And so there is a chance that it could eventually recur or return as a stage 2 or a stage 3 or a stage 4. But we want to do whatever we can do to make that chance as small as possible,
Great,
right?
yeah.
Okay.
Can
So,
I ask a quick question
please,
about,
please.
when she had her phone conference with Dr. Archer,
Yeah.
and I mentioned it to the gentleman that
Yeah.
came in.
Yeah.
They noticed the only other thing that lit up warm was the right armpit lymph nodes.
Mm-hmm.
And of course, we think it's extraordinarily unlikely that it would jump through her body, across her chest, into the other armpit.
Yeah.
Nothing is ever guaranteed, but through your monitoring after this is concluded, presuming that somehow after a COVID vaccine, those should simmer down. I can't imagine they will always be warm nodules. Will you be able to know in the follow-ups if that has been remediated and gone away?
Absolutely. So,
Okay.
so part of any cancer treatment, whether it's surgery or radiation or whatever, comes with very intensive monitoring thereafter.
Right.
Right. And so we don't usually use PET scans in the routine follow-up, but even CAT scans, which is standard,
Right.
we'll be able to monitor those lymph nodes.
Okay,
right?
good.
And so what we'll want to see is they don't show signs of continued growth.
Right.
So as you said,
Right.
very, very unlikely. And if God forbid, on the CAT scan in 3 or 4 months, the initial one after the radiation is done, if we see that they're continuing to grow in a way that's suspicious, then by all means we jump in and investigate further.
Right.
Right?
Yeah.
And that goes with anything that we see.
Anything,
right? Not
right.
just there,
Yeah, just
right?
anything.
We're monitoring the lymph
Yeah,
nodes
yeah.
in the center of the chest and the rest of the lungs, etc. So this is a picture, excuse me, of your PET scan. And when you look at a scan like this, okay, this is the front of your body here. You want to roll forward a little bit?
Yeah.
Okay. Okay. This is the front of your body here. This
Yeah.
is the back of your body.
Yeah.
This is the right side and the left side. It's reversed because it's as though you're on your back with your feet coming out towards us.
Okay.
This here is your right lung, it's black, and this is your left lung. And that little spot that glows there or lights up bright, as you were saying, is the tumor.
Got it.
Okay? Right here. And so what we're going to do is use a few treatments of radiation, probably 3, okay? And we're gonna put a very intense, that's not the right one. We're gonna put a very intense ball of radiation around the tumor, just like that, okay? Sorry, I have to take this call.
Go ahead,
I'll
take
be
the
right
call.
back, okay?
Yep. This is video 1, Bridget.